May 12, 2017. Hospital screens lock mid-shift. Ambulances rerouted. Thousands of appointments vanish from the calendar, not because doctors walked out, but because a worm turned unpatched Windows into ransom notes. The National Health Service in England became the public face of WannaCry. How does Patch Tuesday miss award? Tonight's corporate breach case is WannaCry 2017 and the NHS hospitals that could not outrun a worm. Figures from the UK National Audit Office, NHS England's Lessons Learned Review, BBC reporting, and Microsoft's MS17-010 bulletin. Full links in the description. We cite counts. We don't invent them. This is not a spreadsheet breach. When clinical systems freeze, the waiting room is a human being with chest pain, a child with a fever, a parent waiting on a scan. Cyber risk in healthcare is measured in diverted ambulances and canceled operations, not only in stolen records. The NEO called WannaCry the largest cyber attack to affect the NHS in England to that point. NHS England runs a network of 236 hospital trusts plus thousands of GP surgeries, a national health service on Windows desktops, imaging systems, and shared file shares. Invisible plumbing. Until the plumbing demands $300 in Bitcoin to unlock a blood test workstation. On Friday morning, WannaCry spread worldwide. Europol later said more than 230,000 computers in at least 150 countries were infected within a day. English hospitals saw the skull wallpaper and the countdown timer. Non-critical emergencies turned away. Some trusts took email offline to slow the worm, cutting the digital vein staff rely on. Between May 12th and 18th, NHS England tracked the damage. The NAO reported 6,912 appointments cancelled and rearranged. Surgeries and clinics dropped from the board. Officials estimated more than 19,000 appointments would have been cancelled in total once follow-ups were counted. Real people, real dates erased. Rewind 2 months. On March 14, 2017, Microsoft issued Security Bulletin MS17-010, a critical patch for a flaw in Windows file sharing, the SMB protocol. The fix existed before the ward went dark. Hospital IT teams live inside change control boards, vendor contracts, and 24/7 uptime pressure. A patch is not a button. It is a governance decision. Here is the first turn. WannaCry was not a targeted spearfish against one trust. It was a worm, scanning networks for open doors left by a leaked exploit. Hold that question. Why did a 2-month-old patch still leave the front door open on a Friday? Security researchers tied the outbreak to EternalBlue, an exploit of Microsoft's SMB implementation that had circulated after the Shadow Broker's leak. Plain English. Attackers did not need your password if your machine answered on a vulnerable file-sharing port. The U.S. National Security Agency had known about the flaw years earlier. Microsoft patched supported versions in March. Unpatched boxes became stepping stones. Walk the path. A leaked SMB exploit hits the internet. Unpatched Windows exposes the port. The worm scans the local network and jumps machine to machine. Ransomware encrypts files and posts a Bitcoin demand on screen. No phishing email required, just one forgotten patch on a connected clinical workstation. The NAO found at least 81 out of 236 NHS trusts in England were affected, more than a third of the system. 34 trusts were infected and locked out of devices. Another 603 primary care organizations were hit, including 595 GP practices. Wales and Northern Ireland reported no impact, but England's Friday became a case study. Press reporting described tens of thousands of NHS devices potentially affected, not only laptops, but MBRI interfaces, blood storage refrigerators, and theater equipment on the same flat networks. NHS England later stressed most infected devices ran supported Windows 7 builds that simply had not received the March patch, not the outdated XP headline alone. By Saturday, a British security researcher named Marcus Hutchins registered a garbled domain buried in the malware code, accidentally triggering a kill switch that slowed the global wave. Heroic spot time. They did not patch the estate. NHS staff worked through the weekend of May 13th and 14th, fearing a fresh infection spike on Monday morning. Second turn. Officials told the No NHS organization paid the ransom, roughly £230 on the lock screen. Refusing extortion did not restore calendars. The bill moved to cancelled care, overtime IT crews, and a nation asking how basic hygiene failed inside hospitals. NHS Digital advised trusts not to pay. The Department of Health, NHS England, and the National Crime Agency told auditors no ransom was sent. That is the correct playbook. Paying does not guarantee decryption and funds the next wave. But the opportunity cost was visible in hallways, diverted patients, idle scanners, and staff on paper runbooks. The NAO documented 5 accident and emergency departments that could not treat some patients. Ambulances diverted, journeys lengthened. Data on GP cancellations was never fully collected. When auditors write no patient data was stolen, families still remember the day their operation was postponed. Harm is not only identity theft. NHS England's review identified at least 139 patients with urgent referrals for potential cancer who had appointments cancelled between May 12th and 18th. Not every delay equals a worse outcome, but in oncology, days matter. A worm written for Bitcoin still touches the most frightened waiting rooms. NHS leaders told the BBC no harm was caused to patients and no patient data was compromised or stolen. The official position auditors repeated. Critics asked how that squares with diverted emergencies and cancelled cancer pathways. The gap between no data breach and real-world disruption is where healthcare cyber stories live. In October 2017, the National Audit Office published its investigation. Comptroller Sir Amias Morse said WannaCry was a relatively unsophisticated attack that could have been prevented if the NHS had followed basic ID security best practice. Harsh words from an accountant, because the patch bulletin was already public. The Department of Health and Social Care later estimated the attack cost the NHS roughly £92 million, disruption to services plus IT upgrades and recovery work. The NAO noted it could not fully audit every local cost. Ransomware that demanded $300 per screen left an 8-figure national repair bill. Third turn. WannaCry was not a Hollywood studio leak or a credit bureau exfiltration. It was patch debt plus worm speed inside a system that cannot take a lunch break. If one unpatched SMB port can freeze a trust, what does recovery look like on Monday morning, when the kill switch is not a strategy? Stack the receipts. 81 trusts affected. 6,912 appointments canceled. More than 19,000 estimated in total. 139 urgent cancer referrals disrupted. No ransom paid, but roughly £92 million in estimated NHS cost. Cost of failure measured in wards, not wallets alone. Cleanup is blunt. Patch SMB class flaws on clinical networks first. Test imaging and lab interfaces, not only finance laptops. Segment trusts so one worm cannot scan the whole county. Keep offline backups for devices that cannot reboot on Patch Tuesday. Run weekend recovery drills before a Friday outbreak. And treat missing March patches as a patient safety issue, not a back office chore. Which corporate failure should we open the file on next? Comment below. This was Corporate Breach. Sources include the UK National Audit Office, NHS England's WannaCry Lessons Learned Review, BBC coverage, and Microsoft's MS17-010 bulletin. Full links in the description.